Hey, I wanted to share another exercise with you that is really good for strengthening your neck, decompressing your cervical spine, and getting rid of symptoms out of your arms, your hands, your fingertips. It's called the head float. The head float basically strengthens the deepest core muscles in your neck. It's called the longus colli and the longus capitis. You also have deep muscles in the back of your neck, straight down in the back of the neck. It actually goes down along the entire spine. And those are called the multifidi muscles. So for the head float, you would be surprised how heavy your head actually is, but it is the best way to strengthen your neck. Now, if you get symptoms of increased numbness or tingling or increased pain, then just stop. You can either modify the exercise by changing the position of your neck or by completely omitting it altogether. So you want to listen to your body. It's not always a one size fits all. You may be in more of an acute flare-up with your cervical radiculopathy, or you might have just kind of some chronic tension in your trapezius muscles. You might have some weakness in your neck and you may not even know it. So this is how you do it. Okay, so first you want to lie down on your back with your knees bent and your feet flat. Then bring your head to the middle and just see where your head is positioned. Try to find symmetry in your joints. Bring your shoulders down the back, away from the ears. And if you have a forward head posture and you lay flat on the floor or flat on a mat, chances are your body's going to look more like this. Your chin will migrate up to the ceiling because your upper back may be rounded. So what I want you to do is try to lengthen and elongate the back of your neck so you get into more of a neutral position. Here, my ears are aligned above the shoulders. This is ideal. So then from the neutral position, you actually want to tuck your chin down like you're nodding yes. When I tuck my chin down, I feel the back of my neck stretching and the base of my skull. There's a little bit of pressure there. So as I do this little chin nod or chin tuck, it activates those muscles, deep neck flexors and the multifidi stabilizers. Also, tuck your tailbone under slightly and brace your core abdominals, and then lift your head a millimeter above the mat. Your head should feel really heavy. Rest. Again, chin tuck, brace core, lift, hover, and hold. 2, 3, 4, 5, and rest. You'll know that you're doing it incorrectly or you're shutting your deep muscles off if you do it this way. You tuck your chin, brace your core, and then when you lift your head, your chin starts to go upward and your head tilts back. That means that your neck muscles are really weak. So in that case, you would tuck, brace, use one hand behind your head and just assist. Assist the weight of your head. Just by placing one hand behind your head, you take off a couple pounds. And that's more doable for a lot of you. If you want more challenge, you take away your hand and you can really feel how heavy your head is against gravity. And then rest. Ooh, and then rock it side to side. I can just feel how much strain is caused in the back of my neck and the front of my neck. So with the chin tuck, you're gonna wanna do it 3 to 5 times for a 5-second hold. Once again, tuck chin, brace core, lift, hover, and hold. 2, 3, 4, 5, rest. Tuck, brace, lift, hover, and hold. 2, 3, 4, 5, rest. One more, tuck, brace, lift, hover, and hold. 2, 3, 4, 5, rest. And then relax, nodding your head side to side, back and forth. Now to strengthen the more superficial neck muscles, as long as it doesn't increase numbness or tingling in your fingertips, you're gonna lift your head higher this time. So then you get to use your abdominals. Tuck chin, brace core, curl your chin to your chest, lifting your shoulder blades up off of the mat. So you're literally looking right at your belly button. And hold this position. If your head feels too heavy, place one hand behind your head. Give yourself a little bit of support. And then lower your head back down, keeping your chin tucked. All the way down and release. Tuck, brace, curl chin to chest, eyes on the belly, hold it. 2, 3, 4, 5, lower back down, tuck, brace, curl up, eyes on belly. You can float your arms above the mat also. And this, you should feel it a lot in the front of your neck and even in your abdominals. But this helps to strengthen your neck to reduce compression off of your discs. The wrong way to do it is if when you descend, your neck just goes like this, and then your neck muscles just give up. You want to keep that engaged, okay? So practice that. I think, honestly, 3 repetitions with 5 seconds feels best to me. I mean, my neck is tired right now. I feel like I got a full workout, but yeah, 3 repetitions for 5 seconds. So practice that to help strengthen your neck. Remember, you're trying to build stability to reduce compression in your discs. If you look here at this spine, this is your skull and this is the back of your spine. This is the front. Many people have bulging discs in their cervical spine and their lumbar spine. This one demonstrates an L4, L5 disc bulge. But when you have a bulging disc, it actually pushes out and touches one of these nerve roots. And that nerve root sends a signal down into the arm. If the disc is bulging at C5, C6, you're gonna feel it in like your tops of your shoulders, your bicep, even your shoulder blade. If you have a bulging disc at a lower level, pinching on these nerves, you'll feel it more down into your fingertips. So passive traction is where a patient is laying on their back and I would place my hands under their skull and I would pull. So when you pull, you stretch out the spine and you take some pressure off of those discs. That's helpful, but it doesn't last, meaning it doesn't permanently decompress your neck. The strengthening exercises do. The stabilization exercises do. So you want to do the cervical isometrics and you want to do the head floats. But like I said, if you start to feel increased symptoms, modify the position of your head or neck or omit it altogether. If you feel symptoms in your arms or your radiculopathy increases, then when you start out your head in neutral and you do that slight chin tuck, brace your core, if you start to get increased symptoms, then just back off a little. Even if you're in neutral and you're not in much of a tuck, then lift your head. You're still activating a ton of muscles around your neck. Rest. Maybe you have to arch your neck higher and then lift it up. You're going to strengthen muscles around your neck. No matter what position you're in, you're still going to engage muscles in your neck to strengthen them. It's just that when you do the chin tuck, that activates more the longus colli and the longus capitis. So just do what you need to do to modify the exercise without increasing provocation of symptoms.